Hello everyone, it's Dr. Locklear here, and today we're going to be talking about the concept of fluid and electrolytes. This chapter is very detailed, and I really think you need to make some good notes. I suggest that you take each electrolyte and make you a flashcard and write down the different ranges because these electrolytes are the most common and the most pertinent to our practice. So the ones listed in your chapter here really is something that you definitely need to know. So flashcards are always really good to help you remember. Again, on the new NCLEX, they are going to have the lab ranges for you, but we still need to know what's abnormal. So I would recommend making some good notes as we go through this chapter. There are a lot of terms in this chapter, and so please pay close attention to the terms that are bolded in black, and I would make some notes about those and write those terms down and have them maybe on a flashcard or something, or highlight them in my book or something, because you're going to need to know the terms like cation and ions and electrolytes and diffusion and intracellular and extracellular, just several things. So let's get started. So we're going to look at the physiology of fluids and electrolytes in the body and how do they work and why are they important. We're going to differentiate the alterations in fluids and electrolytes, meaning what happens to my body when my numbers are off. I outline the relationship between fluid and electrolytes with other concepts. Think about perfusion. And I know you guys maybe haven't had perfusion yet, but if my electrolytes are off, then it affects my ability to perfuse appropriately to get the blood supply to the organs, and then I may have some heart dysrhythmias, as you're going to see with potassium and calcium and magnesium and sodium. If those levels are off, you will see some alterations in the heart, and you will see dysrhythmias, and you are at very high risk for a heart attack. We're going to look at the promotion of maintaining fluid and electrolyte balance. We do have to have a balance. There's several examples in the book of dehydration or fluid volume excess. If both can be very difficult. If you have too much fluid, then you could go into congestive heart failure. If you don't have enough fluid, you could have a confusion, you could have a heart attack, you could have a stroke. Look at the common assessment procedures and tests. There are several tests. The physician may order a chemistry panel, and in the chemistry panel will be listed all of your electrolytes. They may order a CBC because you want to look at the RBCs and the hemoglobin and hematocrit. If you're dehydrated, then those numbers are going to be low. What are the interventions that nurses can implement with our patients who are dealing with fluid and electrolytes imbalances? It is very important to maintain appropriate intake and output. And I just had this conversation with my clinical group this week. In clinical, when removing a Foley catheter, you need to document how much output there was. This patient had just had surgery. We lose fluids in surgery through blood loss and other means. So we as nurses have to make sure that we're documenting eyes and nose very carefully and reporting these to the physician. We want to look at the collaborative therapies with the interprofessional team. Maybe these people need to go home with supplements. Maybe they're on a diuretic. They need education about certain types of medicines that can affect our fluid balance. And differentiate considerations related to the care of patients with alterations in fluid and electrolyte imbalance throughout the lifespan. You will see at the end of the chapter how the child under 2 years old is so much more susceptible to early dehydration, which can lead to issues with, again, perfusion and cause a lot of irritation to the brain. The child could have a seizure and die. So let's get started. So what is the concept of fluid and electrolytes? The body is composed largely of fluid in many different forms. It's not just water, because we drink water. We have blood, We have serum in our blood. We have albumin, urine, bile, hormones, and cerebrospinal fluid. These are just a few, and these help maintain the homeostasis. We have to have a delicate balance of these fluids so our body can function. These electrolytes affect pretty much everything that goes on in our body. We have to have a balance. The slightest deviation, again, can cause cardiac dysrhythmias, confusion, can lead to a stroke, many different things. It can affect your blood sugar too. Here is a YouTube video for you to watch, and if I have time, I'll show it in class. So what is the concept of fluid and electrolytes? Within each of these fluids are electrolytes. They are charged ions capable of conducting electricity. We need that to make our heart pump. They are in various concentrations and combinations. So what does that mean? I can't just live off of potassium. My body has to have a combination of these electrolytes because they do specific roles. Learning what fluids contain specific electrolytes helps us identify causes of electrolyte imbalances, especially in patients, and we are specifically designed to restore that homeostasis. Our goal as nurses is to be able to assess when a patient has an imbalance in their homeostasis. We need to look at the labs, and if the labs are abnormal, we need to notify the physician. We need to follow the orders. Did they order IV fluids? Do we need to offer them something to drink? We need to know how to assess for signs and symptoms of fluid imbalance, and we will get to that. Homeostasis depends on multiple physiologic processes. Fluid and electrolyte balance is critical to maintaining health. It can result from a variety of conditions such as dehydration, renal failure, and negatively affect both chronic and acute illnesses. Almost every illness has the potential to threaten this crucial homeostasis balance. Even in the process of daily living, excessive temperatures or rigorous activity can cause an imbalance because you may not be taking in enough water and you may be losing more than you're taking in. For example, it's really warm outside now because we're getting close to summertime, so you maybe don't want to cut your grass or do yard work in the heat of the day because that's when you're going to sweat the most and lose the most fluid, which can cause a heat stroke. And so you want to educate your patients, especially that are susceptible. And we're all susceptible to that. Even if we have a balance of homeostasis, if you get out and do rigorous exercise or work, especially on a really hot day, you are going to lose a lot of fluid just through sweating and through normal breathing. And a lot of times when you're working in the heat, you don't feel the need to drink anything. You may feel a little nauseated from the heat. And so it keeps us from replenishing what we used up with all of that energy. And it can be very dangerous. So we need to educate our patients to maybe do, if you have to do yard work or you like to exercise, do it at a time that you're not going to be out in the heat. That's very important. Especially with children, they're playing sports this day and time. So we need to make sure that they're not getting overheated, to have on those uniforms and those thick socks when they play ball and stuff, and that can cause them to overheat as well. We need to keep them hydrated. So what are we looking at with water? The proportion of the human body is composed of fluid is large, about 60%, and some resources say 70%, but this one, our text here says 60. So 60% of our adult weight is water, which is our primary body fluid. An individual is healthy. When we're healthy, this volume reflected in body weight remains relatively constant, and the individual's weight varies by less than 0.2 kilograms or a half a pound in 24 hours, regardless of the amount of fluid ingested. So when we are in balance, we can maintain a normal fluid intake, but we do have to drink and replenish that fluid every day. Total body water is affected by gender and body size. Of course, your body size affects how much fluid your body absorbs. Because fat cells contain little or no water and lean tissue has a high water content, individuals with a higher percentage of body fat have less body fluid. Women have proportionately more body fat and less body water than men. Water accounts for approximately 60% of adult man's weight, but only 52% of an adult woman's. And that's kind of not good because that means we have the potential to have more um, adipose tissue, fat tissue, which makes our body weight heavier, not from water, but from too much fat tissue, and that's not a good thing. Water is vital to health and normal cellular functioning. We have to have water to make the cells function because there's nutrients in the water. There's hydrogen and oxygen and other things in the water, and that's what makes our cells live. Water helps us with metabolic reactions. It's a transporter for nutrients, waste products, other substances, a lubricant. It insulates and it helps absorb shock, and one means of regulating and maintaining body temperature. So people who are dehydrated, they may run an elevated temperature because their immune system's kicking in and trying to compensate, and you're going to see. So we have intracellular and extracellular fluid. And so intracellular, that's just what it means, in the cell, and extra means out of the cell. So you've got fluid in the cell and we have fluid out of the cell, and it has to be balanced in order to make the cell work. The body's fluid is divided in these two compartments. Both of these contain oxygen from the lungs, dissolved nutrients from the GI tract, excretory products of metabolism such as carbon dioxide. When we breathe out CO2, and charged particles called ions. So here again, these two pages, 358 and 359, have a lot of bolded terms, so you really do need to know these terms, okay? The composition of fluids varies from one body compartment to another. Many salts dissociate in water. That is, they break up into electrically charged ions. The salt sodium chloride breaks up into one ion of sodium, which is a positive charge, and one ion of chloride, which is a negative charge. These charged particles are called electrolytes because they are capable of conducting electricity. And this electricity, such as from the sodium, helps our heartbeat, as does potassium. These charged particles are electrolytes because they conduct the electricity. The number of ions that carry a positive charge are called cations, and the number of ions that carry a negative charge are called anions. They should be equal. Examples of cations are sodium, potassium, calcium, and magnesium. Examples of anions are chloride, bicarbonate, phosphate, and sulfate. And so they're positive and negative, and that's what balances each other. So when I have too much sodium or too little sodium, the chemical charge is not balanced, and it's going to cause some irregularities in my body. Now let me just stop here a minute and say this. I do not expect you all to know this stuff as a chemist would. I don't know this stuff as a chemist. As a nurse, I know that electrolytes are important in regulating function of the cells and muscles, and when they are altered, you will see symptoms. And so, again, I don't expect you to know this as somebody in a chemistry course would know that, okay? Because this chapter can be very overwhelming. Electrolytes generally are measured in milliequivalents per liter of water, so MEQ/L, or milligrams per 100 milliliters. The term milliequivalent refers to the chemical combining power of the ion, or the capacity of cations to combine with anions to form molecules. This combining activity is measured in relation to the combining activity of the hydrogen ion. So 1 milliequivalent of any anion equals 1 milliequivalent of a cation. The milliequivalent system is most often used in clinical. Nurses need to be aware that different systems of measurement may be found in interpretations of lab results. So again, we're going to have those lab results that's going to help us see the normal ranges and, to help us remember the ranges of these electrolytes. So this is, again, terms, cations, anions, they have to balance each other, okay? So what is extracellular fluid? This is found within the cells of the body. It constitutes approximately 2/3 of the total body fluid in adults. So the fluid we have, 2/3 of it is in the cell. ICF, or intracellular fluid, is vital to normal cell functioning. So when you are dehydrated, your cells are dehydrated as well, and they can die, and so you're losing cells, which loses your ability to have correct functioning in wherever these cells are, okay? So it's so important to keep the cells hydrated. In the cell, it contains solutes, substances that dissolve in liquid, such as oxygen, electrolytes, glucose, and it provides a medium in which metabolic processes of the cells take place. So this solute in the cell helps the cell dissolve these particles in the fluid and the water in our cell. The extracellular fluid is found outside the cell and accounts for about 1/3 of the total body fluid. It is subdivided into intravascular, interstitial, or transcellular. So intravascular, or plasma, is 20% of the ECF, and it's found within the vascular system, just like it says, intravascular. Interstitial is about 75% of the ECF. It surrounds the cell. Excuse me. The other compartments of ECF are the lymph and the transcellular fluid. So let's go back to interstitial. This is the fluid around the cell. So sometimes when you have a lot of edema, you have too much fluid outside of the cells. If you get too much fluid in the cell will rupture and die, and then you're losing cells, which causes you to lose function. But the interstitial fluid is the fluid you'll see in the tissues. It's outside of the cell, it gets in your tissues, and that's why you see people with swollen feet, because their liver and kidneys can't filter fast enough to get the fluid out, or the pumping action of the heart is poor and the fluid is building up and it's got to go somewhere. So when it's outside of the cell, it's in your tissues and you have this swelling. Transcellular fluid is cerebrospinal, pericardial, so that's around the heart, pancreatic, pleural, intraocular, and around the eyes, biliary, and peritoneal, and synovial. And peritoneal is in the abdominal cavity. In ECF, the principal electrolytes are sodium, chloride, and bicarbonate. Others are potassium, calcium, magnesium, but in much smaller quantities. Plasma and interstitial fluid, the two primary components of ECF, plasma and interstitial fluid, contain essentially the same electrolytes and solutes with the exception of protein. Plasma is a protein-rich fluid containing large amounts of albumin. Interstitial fluids contains little or no protein. Although ECF is the smaller of the two, it is the transport system that carries nutrients to and waste products from the cell. So the fluid surrounding the cell is taking these nutrients to the cell, and it's getting rid of the waste products from the cell, which is good. Our body's got to get rid of the stuff that it doesn't need, or we can become very sick and toxic from that. Interstitial fluid transports waste from the cell by the lymph system, as well as directly into the blood plasma through the capillaries. Other body fluids, such as gastric and intestinal secretions, also have electrolytes. So if you're having a lot of diarrhea or you're vomiting too much, then your electrolyte balance is going to be off. And these two, diarrhea and vomiting, causes dehydration very quickly because we can't keep anything down, so we're losing fluid. Excessive loss of these fluids from the body, such as vomiting and diarrhea or gastric suction, is a particular concern. Look at table 6-1, and it gives you the electrolyte concentrations in the fluid compartments. Also on page 358, it gives you a little diagram of intracellular fluid and extracellular fluid. I would read over that, okay? Just that'll just help solidify the reading. All right. Kind of gone through these slides. I got a little ahead of myself here. Okay, so osmosis on page 359. So what is osmosis? It is the movement of water across the cell membrane from the less concentrated solution to a more concentrated solution. So in other words, water moves towards the higher concentration of solute to equalize the concentration on either side of the membrane. So osmosis is constantly happening to balance the concentration of fluid inside the cell and outside the cell. There has to be a balance. Remember, if you have too much fluid outside, interstitial, you're going to have swelling in your tissues. If you have too much fluid in the cell's going to rupture and die, and we're going to have adverse effects from that. So it's the movement, it's constantly moving from the less concentrated solution to the more concentrated solution. Concentrated means it's thicker. If it's less concentrated, then I have more fluid there. When you think of concentrated, think of something thick like concrete or dough that you're making homemade biscuits out of, something pasty. So it knows when to move more water into these less concentrated solutions, are more concentrated. So again, it's water across cell membranes from an area that's pretty well got a lot of fluid or enough to an area that's more concentrated, meaning thicker. So I need more fluid in the concentrated area. Okay, I hope that's clear. Solutes may be crystalloids. These are salts that dissolve readily into true solutions, or colloids, substances such as large protein molecules that do not readily dissolve in true solutions. A solvent is the component of a solution that can dissolve a solute. An example is a solvent relationship is sugar added to coffee. Sugar is the solute and coffee is the solvent. Okay, does that make sense? I thought that was a good explanation. The concentration of solutes in body fluids is usually expressed in the osmolality. Osmolality is determined by the total solute concentration within a fluid compartment and is measured as parts of solute per kilogram of water. So it's reported in milliosmoles per kilogram, and you'll see it MOSEM/kg on your lab report. Sodium is by far the greatest determinant of osmolality of extracellular fluid, with glucose and urea also contributing. Potassium, glucose, and urea are the primary contributors to osmolality of intracellular fluid. These substances are referred to as solutes and move from one side to the other side across the membrane. So in other words, osmosis is constantly balancing Okay, and it will use the the solutes and to dissolve these nutrients and particles that we need to get to an area that's more concentrated than the area that's less concentrated. Remember, less concentrated means I have pretty much enough fluid, but I'm going to get these um, nutrients and uh, um, uh, pieces, proteins, and things like that into an area that's concentrated because it doesn't have enough fluid. And these solutes help do that. They help dissolve these proteins and um, uh, uh, nutrients that we need to get to that area that is so thick and concentrated. So the term tonicity may be used to refer to the osmolality of a solution. Tonicity represents the balance between the amounts of water on either side of a membrane. Different states of balance can exist relative to the sides of the membrane. A patient may be in a hypotonic condition if there is a lower concentration of solutes to water, because you have to have these solutes to help break down the nutrients and the proteins that the cell needs to utilize. That's why that's important. The opposite exists in hypertonic states when there is a higher concentration of solutes in relation to water. So if I'm hypertonic, I have too many solutes and I don't need that many. It's taking over. It's bringing in too much to the cell, and it's going to cause it to be, as the word says, kind of hyperactive, and we don't want that. We want it to be balanced. Patients who are dehydrated are hypertonic. So again, here I've got too many solutes. It's breaking down too much too fast, and it's causing the water to shift and the fluid to shift, and the cells are now getting dehydrated. So that would be a hypertonic state. Crystalloid solutions are used to manage balance through the tonicity of the solution. And you need to know these: isotonic, hypertonic, hypotonic. You need to know those. An isotonic solution has the same osmolality as body fluids. Isotonic solutions do not result in any movement across the membrane. They represent normal body fluids. Normal saline, 0.9%. So when we say, go get us a bag of normal saline, you need to get the 0.9%, because there are fluids called half normal saline, which is 0.45%. So make sure that you are clear on what your physician wrote. Do they want normal saline or half normal saline? Normal saline is 0.9%. It's a sodium chloride. You also have lactated ringers, and this is considered an isotonic solution as well. These are indicated in patients with hypotensive and hypovolemic states, since these patients require volume expansion. So normal saline and lactated ringers mimics normal body fluids. So if I am in a dehydrated state, or such as hypovolemia or hypotensive, my blood pressure is too low, they are going to order normal saline or lactated ringers, because this is not going to do anything to the cell. It's just going to add fluid volume to get the pressure back up and to get you hydrated, to get your intracellular and extracellular areas just hydrated. Okay, I hope that's clear. Hypertonic solutions have a higher level of solutes and include fluids such as 3% sodium chloride, D5 normal saline, D5 lactated ringers. Hypertonic fluids pull fluid from the cells into the vascular space. These fluids are used in patients with elevated intracranial pressure. So with these fluids, we're trying to get the fluid out of the cell because the cells are too full and to rupture. And we don't want them to rupture because that causes death to the cell. So it's going to pull fluid out of the cell back into the extracellular space and hopefully filtered out through the kidneys and put out as urine. So they will use a hypertonic solution. Hypotonic solutions have less solutes than isotonic fluids. And some examples again, 0.45 normal saline, or referred to as half normal saline, or D5 and half normal saline. Hypotonic solutions cause fluid to move into the cells and are indicated with patients with dehydration or hypernatremia. So, hypertonic, you're going to see these patients that have intracranial pressure issues. Hypotonic, you're going to see with dehydration or hypernatremia states. Isotonic are used for patients who just need volume. They've lost a lot of fluid and they just need volume, period. Okay? I hope that makes sense. Please read over that thoroughly. All right? Osmotic pressure is the power of solution to draw water across the semipermeable membrane. When two solutions of different solute concentrations are separated by a semipermeable membrane, the solution of higher solute concentration exerts a higher osmotic pressure, drawing water across the membrane to equalize the pressure. For example, infusing a hypertonic IV solution, such as 3% sodium chloride, will draw fluid out of red blood cells, causing them to shrink. On the other hand, a hypotonic solution administered IV will cause the RBC to swell as water is drawn into the cells by higher osmotic pressure. In the body, plasma proteins exert an osmotic draw called colloid osmotic pressure or oncotic pressure, pulling water from the interstitial space into the vascular compartment. This is an important mechanism in maintaining vascular volume. So in other words, again, I said this a little earlier, a couple of pages back, sometimes we have to pull the fluid out of the cell back into the extracellular space, okay? And the osmotic pressure and some of these fluids that we use help us to do that. It causes the fluid to come out of the cell. The cell will shrink a bit and hopefully get back down to a normal size and be able to function. But we're pulling fluid out of the cell to get some more fluid back in the vascular system as well to help maintain a balance, so our blood pressure can stay up and our kidneys can filter and our intracranial pressure stays normal. All right. I know that's a lot, but if you take your time and read through it, it does make sense. This book explained it very, very well. Diffusion is the continual intermingling of molecules in liquids, gases, or solids brought about by the random movement of the molecules. So, for example, two gases become mixed in the constant motion of the molecules. The process of diffusion occurs when two substances are separated by a thin membrane. In the body, diffusion of water, electrolytes, and other substances occurs through the split pores of the capillary membranes. So, in other words, you've got these two, like they give an example here, two gases. And with diffusion, it separates them and puts them kind of where they need to be. Sometimes they can't be in the same place together because it causes problems in functions of the cell. Okay, so this diffusion is going to help separate these so they're not interacting with each other in a negative aspect. Filtration is a process whereby fluid and solutes move together across a membrane from one compartment to another. The movement is from an area of higher pressure to one of lower pressure. An example is the movement of fluid and nutrients from the capillaries of the arterioles to the interstitial fluid around the cells. The pressure into the compartment that results in the movement of the fluid and substances dissolved in fluid out of the compartment is called filtration pressure. Hydrostatic pressure is the pressure a fluid exerts within a closed system on the walls of its container. The hydrostatic pressure of blood is the force of blood exerted against the vascular walls or the artery walls. The principal volume in hydrostatic pressure is that fluid moves from the area of greater pressure to the area of lesser pressure. In other words, balancing the pressure. Because if think about blood pressure. If the force of the blood going through the vessels is too strong, it'll rupture the vessel. So same mechanism here. The principle involved in hydrostatic pressure is that the fluid moves from the area of greater pressure to an area of lesser pressure. Using the example of the blood vessels, the plasma proteins in the blood exert a colloid osmotic or oncotic pressure that opposes the hydrostatic pressure and holds the fluid in the vascular compartment to maintain the vascular volume. So it helps balance the volume in the vascular system, which maintains our blood pressure. When the hydrostatic pressure is greater than the osmotic pressure, the fluid filters out of the blood vessels, which can lead to the development of edema, again in the interstitial spaces, the fluids out of the cells. Swelling caused by excess fluid trapped in the body tissues. The filtration pressure in this example is the difference between hydrostatic pressure and osmotic pressure. So hydrostatic pressure, again, is the pressure a fluid exerts within a closed system on the walls of the container. So, in other words, they give you like a blood cell, and they pull it out to decrease the pressure in the cell and balance the vascular volume. Helps maintain your blood pressure. Active transport. Substances can move across cell membranes from a less concentrated solution to a more concentrated one by active transport. This process differs from diffusion and osmosis in that metabolic energy is expended. In active transport, a substance combines with the carrier on the outside surface of the cell membrane, and together they move to the inside surface of the cell membrane. Once inside, they separate, and the substance is released to the inside of the cell. Each substance requires a specific carrier. Active transport requires enzymes, and energy is expended. Active transport is particularly important in maintaining the differences in sodium and potassium ion concentrations of extracellular and intracellular fluids. Under normal conditions, sodium concentrations are higher in the ECF and potassium concentrations are higher inside the cell. To maintain these proportions, the active transport mechanism, the sodium-potassium pump, is activated, moving sodium out of the cells and potassium into the cells. So in other words, you have to have a balance of sodium and potassium in the cells, because if I have too much potassium, my cell's going to be irritated. I'm going to have too much, remember, electrical conduction there, and it's going to be hyperactive. Same thing with sodium. If I have too much, it's going to be hyperactive. If I don't have enough, then it's not going to act appropriately, therefore leading to cardiac dysrhythmia, stroke, muscle spasms, seizures. We have to have that balance of those electrical positive and negative ions. Regulating body fluids. Fluid intake and fluid loss are normally balanced. Illness can upset this balance, so the body has too little or too much fluid. Fluid balance can result in a number of illnesses and conditions. The most common example is dehydration, a condition that occurs when a body does not take in as much water as it is losing, or it lacks the ability to reserve and maintain proper function because it doesn't have enough reserves. Edema and hypervolemia, which means too much volume, occur when the body has excess fluid. Fluid intake. During periods of moderate activity, At moderate temperatures, the average adult drinks about 1,500 milliliters per day, but needs 2,500 milliliters per day, an additional 1,000. So it doesn't all just come from drinking fluids. It comes from the foods we eat, and uh, uh, it's just not always water, okay? Um, this added volume is required from foods, and the oxidation of foods during the metabolic process, the breaking down of food. The water content of food is relatively large, contributing about 750 milliliters per day. So our food does have a lot of water in it. The water content of fresh vegetables is about 90%. That of fresh vegetables, fresh fruits is 85%, and lean meats is 60%. So if we eat vegetables and fruits, we're going to get a lot of water. Water as a byproduct of food metabolism accounts for most of the remaining fluid volume required. This quantity is approximately 200 milliliters per day for the average adult. And you see table 6-2 on the bottom of 361 gives you the average daily fluid intake for adults. The thirst mechanism is the primary regulator of fluid intake. It's located in the hypothalamus of the brain. A number of stimuli trigger this area, including osmotic pressure of body fluids, vascular volume, and angiotensin. This is a hormone released in response to decreased blood flow to the kidneys. So we have been. I apologize for the pause. I had to stop for a few moments. So I'm going to pick up on page 362 where it's talking about the obligatory losses. I think I had covered everything up till that point. So certain fluid losses are required to maintain normal body function. These are known as obligatory losses. An adult must excrete approximately 500 milliliters of fluid through the kidneys each day to eliminate metabolic waste, so the toxins and the things that our body doesn't need. Losses of water through respirations, through the skin, and in feces are also obligatory losses necessary for temperature regulation and elimination of waste products. The total of all these losses is approximately 1,400 milliliters per day. So again, basically what we take in, we're going to excrete. The body's going to get what it needs. So if I drink 2,000 milliliters of fluid a day, my output should be roughly around 2,000 milliliters as well. So now I'm going to get caught up on my slide here, and we're at maintaining homeostasis on page 362. The volume and composition of body fluids are regulated through several homeostatic mechanisms. As the kidneys regulate and filter waste, they return electrolytes such as potassium and sodium to the blood for use. The cardiovascular and respiratory systems ensure that the body has adequate oxygenation to function and use fluid and electrolytes appropriately. The immune system destroys foreign particles and pathogens that can undermine homeostasis. Hormones such as the antidiuretic hormone, also known as arginine vasopressin or AVP, the renin-angiotensin-aldosterone system, and the atrial natriuretic factor are involved, as are mechanisms to monitor and maintain vascular volume. So all of these help maintain fluid balance so we're not getting in fluid volume overload and affects our blood pressure and our heart rate. Injuries or illnesses to any one of these systems can have a negative effect on homeostasis. Illnesses and disease such as cancer affect the balance directly by their destructive presence. We know cancer destroys the cells. They also have an indirect impact by the nature of the treatments required to rid the body of the illness, such as chemo. It kills the good cells with the bad, and it also causes a lot of nausea and vomiting and diarrhea as well. The kidneys are the primary regulator of body fluids and electrolyte imbalances. They regulate the volume and osmolality of extracellular fluid. The kidneys adjust the reabsorption of water from the plasma. Although 135 to 180 liters of plasma per day is normally filtered. Now, this is plasma. It's talking about plasma. An adult filters about 1.5 liters of urine per day. Electrolyte balance is maintained by selective retention and excretion by the kidneys. They also play a significant role in acid-base regulation, and that's in Chapter 1, and we'll talk about that on another recording. The antidiuretic hormone regulates water excretion from the kidneys. It synthesizes in the anterior portion of the hypothalamus, and it acts on the collecting ducts of the nephrons. When serum osmolality rises, ADH is produced, causing the collecting ducts to become more permeable to water. This increased permeability allows more water to be reabsorbed into the blood. As more water is reabsorbed, urine output falls and serum osmolality decreases because the water dilutes body fluids. If serum osmolality decreases, antidiuretic hormone is suppressed. The collecting ducts become less permeable to water and urine output increases. So the ADH helps regulate how much fluid needs to be filtered through the glomeruli of the nephrons in the kidneys. And if your ADH is off, then we may have too much excretion, or we may have not enough excretion and have too much fluid. Excess water is excreted and serum osmolality returns to normal. Other factors that affect the production and release of ADH are blood volume, temperature, pain, stress, and some drugs such as opiates, barbiturates, and nicotine. And you know, we know smoking has a lot of effect on pretty much everything that we do. Specialized receptors in the juxtagular glomeruli cells of the kidneys in the nephrons respond to changes in the renal perfusion. Everything goes through the glomeruli and the nephrons in the kidney. If the blood flow or pressure to the kidney decreases, renin is released. Renin causes the conversion of angiotensin to angiotensin 1, which is then converted to angiotensin 2, the angiotensin converting enzyme, or ACE, released from the lungs. Angiotensin 2 acts directly on the vasculature and promotes vasoconstriction. It acts on the nephrons to promote sodium and water retention. So it says, hey, you're getting rid of too much, I'm kicking in, I'm going to stop you from getting too much, okay? Aldosterone promotes sodium retention in the distal nephron. The net effort of the renin-angiotensin-aldosterone system is to restore blood volume and renal perfusion through sodium and water retention. So directly, these systems here helps maintain homeostasis by regulating how much volume of our fluids is excreted or retained from the kidneys, okay? That's basically what they do. Regulating electrolytes. Electrolytes are present in all body fluids and compartments. Just as maintaining the fluid balance is vital to normal body function, so is maintaining electrolyte balance. Although the concentration of specific electrolytes differ between fluid compartments, a balance of these cations, the ions and the anions, like I said earlier, positive and negative charge, has to always exist. Electrolytes do the following: maintain fluid balance, contributing to acid-base regulation, facilitating enzyme reactions, and transmitting neuromuscular reactions. And so when you have electrolytes and they're coming from dietary intake, they're excreted in the urine. But the body doesn't store sodium and chloride. Potassium is stored and calcium is stored. So as we eat, our body replenishes the sodium with the foods. That's why it's important to have a proper diet. So now we're going to look at the specific electrolytes. So sodium, it is the most abundant. The levels are 135 to 145, and it regulates water balance. So if I have too much sodium, I'm going to have, sodium retains fluid. So if I have too much sodium, I'm going to have excess fluid, I'm going to have swelling. I may could have just congestive heart failure, shortness of breath. And so people with heart problems don't need, they need decreased sodium. Basically, don't add salt to your food because food normally has sodium in it. It regulates our water balance. It's found in many foods, bacon, processed foods, canned foods, table salts. It's in a lot of our foods, a lot of our meats, and some of our processed foods, canned foods. They put sodium in it as a preservative. The suggested intake is 1,500 to 2,300 milligrams per day. Okay, the next one is potassium, and it's the major cation in intracellular fluid. There's a small amount in plasma and extracellular fluid. Excuse me. The normal levels are 125 to 140 in intracellular fluid. The normal serum levels are 3.5 to 5.3. Now, some places say 3.5 to 5.0, and ATI may say 5.0, but your text here references 5.3. For me, that's kind of on a higher end because I'm used to seeing 3.5 to 5.0, but we will go by the text. The ratio of intracellular to extracellular potassium is important for neuromuscular response. So remember, it helps our muscles work. What is the heart? It's the muscle. If my potassium's too low, my heart muscle is going to get irritated because that potassium helps with that electrical conduction. If my potassium's too high, I'm going to have irritation to my muscles. I'm going to have muscle cramps. That's what my heart is doing. It's cramping, so to speak, and I'm going to have, my heart can't pump if it's cramped up, and so I'm going to have a heart attack. That's what's going to happen. It's vital for skeletal, cardiac, smooth muscle. If you hear people complaining of leg cramps a lot, their potassium needs to be checked. It helps maintain acid-base balance. It contributes to intracellular enzyme reactions. So we have to have that positively charged potassium electrolyte to help enzymes do their job. Must be ingested daily. We have to have something like this morning for breakfast. I had some orange juice. Orange juice is very high in potassium. Bananas, green leafy vegetables, sweet potatoes. So you see this a lot in fruits and vegetables, meats, and fish. These are things we should recommend to our patients. Calcium is found in skeletal muscles and a small amount in extracellular fluid. It regulates muscle contraction as well and relaxation. So if you're having cramping again, you can have cardiac dysrhythmias as well. It's reported levels in two ways. The normal total serum calcium is 9 to 11, and the ionized is 4.25 to 5.25. As we age, the intestines absorb calcium less effectively, and it gets excreted by the kidneys. So what does that mean, Dr. Locklear? It means that my bones can become weak, and especially women who are going through menopause, because we don't have the hormones to help the calcium get into our bones and make our bones strong. And calcium also has to have phosphorus and vitamin D to make it function correctly. Milk and milk products such as cheese, yogurts, those type of things, and green leafy vegetables, and canned salmon or salmon, ever how you want to say it. All depends on where you're from, okay? Magnesium is found in skeletal muscles. It's the second most abundant intracellular cation, 1.5 to 2.5, and it helps intracellular metabolism. It helps with protein and DNA synthesis into the cells, regulates, again, neuromuscular and cardiac functioning. So a lot of times when you're having a baby, and I don't know, you guys will learn about this in 113, you may have to give mag sulfate to keep them from having what's called tetany, and that's like seizures of the muscles, because that can happen when you're pregnant. It's found in cereal grains, nuts, dried fruits, legumes, which are beans, green leafy vegetables, dairy products, meats, and fish. We have to have all of these. Chloride, 95 to 105, with sodium, regulates the sodium osmolality. So it helps that balance of these electrolytes such as sodium in the cells. It's a major component of gastric juice, such as your HCl. It buffers in oxygen and carbon dioxide as it exchanges in the red blood cell, and it's found in foods such as the same foods as phosphate, 2.4 to 4.5, much higher level in children. Muscles, nerves, RBCs. So phosphates, they again, they affect muscles such as potassium and sodium and your magnesium do. They're found in fish, meat, poultry, proteins, legumes, and their job is metabolism of protein, fat, and carbohydrates. Bicarbonate, regulating acid-base balance, and we're going to learn about that when we talk about acid-base balance, when we talk about metabolic acidosis and alkalosis and respiratory acidosis and alkalosis. But you'll see this in metabolic, and we'll get to that. If our acid base is off, then our bicarbonate is off, and we can get in a lot of trouble. We're very sick people when that happens. Alterations to fluids and electrolytes. So if I have a fluid volume deficit, I'm going to be dehydrated, and I can see this when you look at your text here. It says examples of conditions that commonly require fluid, electrolyte, or acid-base interventions are the GI tract, burns, kidney disorders, oral fluid restriction, anorexia, bulimia, dehydration. We've already talked about all of those. Chronic kidney disease and acute kidney injury. So we know that we have to have the correct balance to make our cells work. If they're too dry, they're not going to work, and if they're too full, they're going to rupture and not work. Compensation. So what's going on with compensation? The body continuously attempts to compensate for a fluid and electrolyte imbalance by shifting fluid and electrolytes from one component to another. So it's rare for only one type of imbalance to occur, but the body will compensate, and it'll try to reserve what it has. Okay. On page 366, it gives you alterations and therapies. It gives you a list here of if you have fluid volume deficit, excess, elevated electrolytes, low electrolytes, chronic kidney disease, and acute kidney injury. Just read over that. It's already a lot of what we said from the reading. So what's the prevalence of this disorder? We see these in diabetes, hypertension, that's associated with hyponatremia, hypomagnesia, and magnesium, and hypokalemia. Use of diuretics. What is a diuretic? Because you haven't had pharmacology yet, but a lot of you know what a diuretic is. It gets the fluid out. If I'm taking Lasix, it works on the loop of Henle in my kidney to excrete the fluid volume, but it also gets rid of potassium. So a lot of people who are on Lasix have to take potassium supplements, but you also have potassium sparing diuretics such as aldactone, spironolactone, and so their potassium may be spared and go up too high. So potassium has to be monitored when you're on diuretics. Medications such as benzodiazepines can cause electrolyte imbalances, and also they can be associated with illnesses and mortality. And I've already said that, because if your imbalance is off enough, you can have a heart attack. Yeah, and that's not good. Concepts related to fluid and electrolyte imbalance. Because fluid and electrolyte balance is critical to maintaining homeostasis, it both affects and affected by other body systems. Throughout the day, the body makes adjustments to changes in the temperature through fluid retention or excretion. To illustrate, think about an athlete during some time of rigorous game like basketball. As the game goes on, more and more sweating occurs. The body's getting rid of excess heat built up by acceleration in metabolism. As more and more heat is lost and the external temperature rises, the body could respond with hyperthermia, which is life-threatening. Imbalance of fluid and electrolytes can severely affect cognition. Moderate to severe dehydration can result in confusion, even in the healthiest adults. You don't have to have other things going on to get confused if you're dehydrated. You feel dizzy, you feel lightheaded, you just feel off. Fluid and electrolyte imbalance can also be a factor in delirium, and best practice indicates that fluid and electrolyte levels can be assessed through diagnostic testing when the patient has the symptoms of delirium. So if you've got a patient that suddenly becomes confused, you need to think of a few things. Do they have a UTI? Have they had a stroke? Are they on digoxin? Because that causes acute delirium. Or are they dehydrated? Are their electrolytes off? Cognition with a focus on confusion. You definitely want to focus on that during your assessment. Cognitive factors may also affect fluid status. Individuals with impaired function due to dementia, other brain disease, or certain drugs that depress the central nervous system may experience impairment of the thirst mechanism, increasing their risk for fluid balance. And I don't know about you, but I get thirsty during the day. And that's just odd. I guess I'm just so busy I don't have time to think about it. But when I get home in the afternoons, I'm so thirsty and I will just drink and drink till I go to bed. Patients with an imbalance in fluid and electrolytes, particularly increases in fluid and sodium, can experience overload in the extravascular spaces, which results in stress on the cardiovascular system. We talked a little bit about that earlier. It can lead to congestive heart failure because you're in overload. And so you will see all this swelling in their feet and lower extremities. Critical relationship between fluid and electrolyte balance and homeostasis has to be managed through assessment. It's necessary to determine the underlying cause of these imbalances. So we need to assess what does assessment include? It includes, looking at their electrolytes, looking at those things that we can actually see and report to the physician. Lifestyle factors such as fluid intake, diet, exercise, and stress affect fluid and electrolyte imbalances. Appropriate replacement of fluids through the day to maintain hydration benefits the heart, lungs, and kidneys. We have to remember, we're 60% water. The delicate balance of fluids and electrolytes is also affected by the foods we consume. Regular weight-bearing exercises and other physical exercise such as walking, running, or bicycling has a helpful effect on calcium and phosphorus imbalance. So how can we modify these risk factors? Stress can increase cellular metabolism, blood glucose concentration, and catecholamine levels. Stress can increase production of your antidiuretic hormone, which in turn promotes retention of fluid and decreased urine output. Intake should be adjusted accordingly. And you have a safety alert. Please always look at the safety alerts in your chapters. Medications may contribute to fluid and electrolyte imbalances. Diuretics are the most often implicated, but antipsychotics make people at risk as well. Drugs such as for overactive bladder, vasoconstrictors, beta blockers, and certain stimulants can cause imbalances resulting from a heat stroke. These medications can impair the body's thermoregulation system, and we have to educate them on these. Heat-related illnesses. Individuals with illnesses and those participating in strenuous activity are at risk for fluid and electrolyte imbalances. Again, I talked about that. Don't get out during the hottest time of the day. Take frequent breaks. Rest and hydrate. Drink water. Be careful drinking stuff like Gatorade, though, because it is specially formulated for people who are losing excessive amounts, like athletes or people who are have poor nutritional intake and they're vomiting and stuff. Gatorade's not something you should just drink just because it tastes good, okay? It is made for a purpose, okay? Drink water before beginning to feel thirsty. Wear lightweight clothes. Work or exercise with others when engaging in activity outside, and try to keep it low impact. Okay, don't overdo it. And when you feel like you're getting too hot, like Monday we were off, I cut my grass. I had to stop 4 times because it was so hot outside, and I had to rest because your body will tell you, hey, you need to stop. Observation in the patient interview. So some of the things you want to look at, you really want to observe. You need to do a very thorough head-to-toe assessment. Edema, hands, feet, flushed face and neck and arms, dry, cracked lips, dry mucous membranes and poor skin turgor on your hands, sunken eyes, the lips will be cracked and their tongue will look dry. You really want to look at skin turgor, look at their skin color. Do really check that skin and look for edema. Some other things you can look at the past medical history. What are their treatments? Are they taking diuretics? Do they have diabetes, high blood pressure, thyroid disease, medications? And they list these there for you. Potassium supplements. I was telling my group yesterday, these little flavor packets for water are full of potassium, and they will elevate your potassium. Food and fluid intake. What's a typical day like? Are you on a restricted diet, maybe because you're diabetic? Fluid output. Do you put out as much as you take in? Fluid and electrolyte imbalances. Have you gained weight? Weigh them, measure their height, take a diet history. Do you have difficulty breathing? Do you have swelling in your hands and feet? And when? Do you have swelling at the end of the day, or do you have swelling all day even when you get up in the morning? Because that's not good. Physical exam, again, look at the skin, the oral cavity, the eyes, the cardiovascular. Are they tachycardic? Is their blood pressure low? Is their blood pressure high? If you, whatever state you're in, dehydration or fluid volume overload, you could be tachycardic. Neurologic, are you having leg cramps? Do you have tetany when they do the Allen's test? And I think that was there a picture in here of the Allen's test? I can't remember. I remember reading that somewhere. Anyway, you should have Allen's test in your fundamentals. Daily weights. Our weight shouldn't fluctuate but about a half a pound a day. So if we're gaining 2 to 3 pounds a day, that's irregular. That needs to be reported. Daily weights, vital signs. Again, are you running a fever? Are you tachycardic? Is your blood pressure elevated or is it low? Fluid volume intake. Are you in a deficit state or an excess state? Not taking in enough, or you got too much. Diagnostic test, and here's a list of some of the diagnostic tests. Excuse me. Of course, serum electrolytes. The CBC, hematocrit, is affected, and it may be low. Osmolality, it'll be affected as well, and urine-specific gravity, if you're dehydrated, it will be concentrated. Independent interviews, you want to compare intake with output. Ask them how much do you drink compared to how much you're putting out. Assess choice and types of fluids consumed and foods. Remember, there's a lot of fluid in foods. Weigh daily, engage the patient in a plan of care, and provide education about diets. And it is very hard to do that in this area. People here eat a very high salt diet, and it's just very hard to teach some of these patients. Look on page 370 when it talks about fluid intake and output. It gives you a list here. Oral fluids, ice chips, foods that tend to become liquid, such as jellos and puddings and things like that. Tube feedings, parenteral fluids, IV meds, and catheter or tube irrigants. And look on page 370 and 371, and it gives you the fluid and electrolyte balance assessment. The view, the skin turgor, the mucous membranes, edema, the eyes, the fontanelles on the child. They should not be sunken or bulging. Heart rate, again, you may be tachycardic, blood pressure, capillary refill, level of consciousness, because we know it can change all of that, okay? So from page 369, that starts your physical exam. So daily weights, vital signs, fluid intake and output, diagnostic test, and again, the CBC, the osmolality, the urine-specific gravity, all of those are important. Again, your independent interventions, looking at, What can we do? What can you do independently? Okay, safety alert. This is on page 373. Consider the outcomes that could occur with inaccurate documentation and recording of I and O. It has to be accurate, and it is important, and some nurses just don't do what they're supposed to do. First, underestimates could lead to increased fluids being administered, which could result in fluid volume overload. Overestimates could lead to fluid restriction, which could result in additional adverse effects. Given the cellular intensity of chemotherapy agents, fluid restriction could lead to toxicity due to dehydration of the patient's extravascular spaces. So what do? We want to, think about how do we educate? Many patients are avid exercisers, and the use of electrolyte replacement fluid is common in exercise, such as in sports. These fluids are used appropriately to replace lost water and electrolytes. It is important that patients understand that these fluids contain electrolytes and that could alter their balance. And it's like I was saying, you don't want to drink Gatorade, if it's not you're excessively sweating or playing bigger sports or doing something like that. Okay. Pharmacological interventions, and this is on page 373. Electrolyte correction depends on specific electrolyte, whether deficit or excess. So hyperkalemia means I have too much potassium, so I need to get the potassium down. One thing, and I really want you to know this, and this says it right here on 373. For example, elevated potassium levels is called hyperkalemia, are ultimately corrected by dialysis, but treatments such as administration of glucose and insulin can help drive the potassium back into the cell. The insulin pulls the potassium out of the extracellular fluid, and that's where you got the swelling from, and it brings it back into the cell, and where it can be used appropriately. It says it pulls it back into the cell where elevated levels will create less risk. A deficit in potassium is known as hypokalemia and is frequently a side effect of diuretics. Hypernatremia is often seen in patients with reduced production of ADH, and it may be corrected by administration of the antidiuretic hormone itself. Sodium deficiency, known as hyponatremia, may be treated with oral sodium supplements. And it said, see the medication feature for more information. And this is on page 373. Please read over this. You have sodium chloride supplements, potassium chloride, serum albumin, dextran 40, and then some IV fluids, and then some diuretics. Please, yes, these medicines are up for grabs on the test. Yes. Okay. Well, so we'll just go ahead and get that out of the way. Infants and young children. Young children, they're more vulnerable to fluid and electrolyte imbalances because their body makeup is different. Their body surface is different. Infants lose more fluid through the kidneys, which are less able to conserve water because they're still maturing. Body surface areas proportionately greater, increasing insensible fluid loss. Infants usually should be eating every 2 to 3 hours. Percentage of body weight that is fluid varies with age. It's highest at birth and higher in premature infants. Infants, children less than 2 lose greater proportion of fluid per day. Again, because their kidneys and some of their organs still are not what we consider mature yet. Respiratory metabolic rates higher during the early childhood. When fluid status is compromised, immature kidneys unable to conserve or excrete water or solutes effectively, so you may quickly see dehydration and fluid imbalances. And remember, children, they may be vomiting, they may have loose stools, and so they're losing fluid like that. They may have to go on a formula called Pedialyte, and some of you that have children may know that. School-age children, GI and diarrhea are the most common imbalances, and some of the symptoms you'll see is capillary refill, appearance of mucous membranes, quality of pulses, skin elasticity, ability to make tears, and urine output. All these will be affected. You need to assess these areas. Children that have diabetes and cystic fibrosis may normally present with some alterations in electrolytes. Additional assessments may be required. So these children are at high risk. Pregnant women, of course, nausea and vomiting. Nausea requiring hospitalization is termed hyperemesis gravidarum, and you'll learn about that in NUR 113. They have weight loss. Yes, you can lose weight from being pregnant because you're throwing up so much you can't eat or drink. They're dehydrated, and if you're dehydrated, your fetus is dehydrated as well. And if your electrolyte imbalance is off, it can affect the fluid. I can't even think. The utero fluid. Lord, I've lost my train of thought. Anyway, it affects the fluid in the sac that the baby's in. And I can't even think of what it's called. I've just lost my mind. I've lectured so much. Anyway, if the electrolyte balance is off, because in the amniotic fluid, ding, 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 oh, goodness, amniotic fluid. In the amniotic fluid is proteins and nutrients. And if yours is off, theirs is off. Okay, so because they get it from, that's how it comes from, mom. Mild forms of nausea can be treated with crackers before rising. Watch your sodium intake when you're pregnant, and high protein snacks and small amounts of liquids. And if the vomiting continues, they need to go see the physician. Normal aging, we just truly have diminished thirst as we go through normal aging. A decline in kidney function. Our nephrons are they age out. They become less able to conserve water in response to the antidiuretic hormone. Increased levels of the atrial natriuretic factor, and I didn't mention that a whole lot, just read over that. Increased sensitivity to salt. Isolation may reduce social interaction. So, old people, they get depressed. They've lost their loved one, they're home alone, they don't eat, they don't drink, and that leads to major problems. And then they may have other risk factors such kidney disease and heart problems and stuff like that, diabetes. So this definitely increases their risk for fluid and electrolyte imbalance. This is a lengthy lecture. This is a detailed chapter. Please, again, read this chapter. Read it. Make you some note cards on your electrolytes, on your labs, on the terms in bold. Go to that table about the medications, okay? Definitely, all this is important that I've gone over, but those are some key things that we really, really want you to know. Thank you so much.